Good afternoon. And on behalf of the National Federation of Families, welcome to Blending Advocacy and Support, the power of peer and family-run organizations as agents of change. Today's presentation is the third in our five-part webinar series, The Urgency of Now, Ending Isolation by Creating Effective Community Ecosystems. Before we meet our remarkable panel, I would like to go over a few housekeeping items. Today's conversation is being recorded. The recording and any additional resources will be uploaded to our NFF website. If you have any technical difficulties, please type your comment and someone will be able to assist you. Please also type your questions for the presenter in the chat box. We will be watching the chat during the entire presentation, and I always encourage you to ask questions, talk, give us your thoughts. Our goal for the series and all our events is to really encourage a conversation between our panel and all those in attendance. We encourage you to ask questions that will assist you in your daily work and with your own family. We will unmute participants. Actually, I'm not sure if we're going to even mute you at this point, but we will be having a dialogue. If you can use the raise your hand button, that would be important. At this time, I would like to introduce you to our partner organization for this presentation, and Maggie Joseph. She's going to tell you a little bit about the Center for Addiction Recovery Support. It's called CARS. Maggie?
Absolutely. Thank you, Gail. Hi, everyone. As Gail said, my name is Maggie Joseph. I am the Training and Technical Assistance Coordinator here at CARS, short for the Center for Addiction Recovery Support. We are the nation's only federally funded training and technical assistance center that's led by recovery professionals with field expertise. We are funded through the SAMHSA Office of Recovery. We do support communities to build and sustain recovery infrastructure across all stages of continuum, which includes prevention, treatment, and long-term recovery. We provide training and technical assistance to individuals, states, and organizations for free, so no cost. And folks can access expert training, consulting, and tools to advance and strengthen addiction recovery services. We do have 4 strategic focus areas to advance addiction recovery support services nationwide. The first being strengthening the peer workforce. So that would include peer support certification, digital recovery, financing, supervision, workplace culture, and career development. We also focus on advancing recovery across service settings. So that would include courts, corrections, and reentry. Clinical treatment, recovery housing, and peer-run orgs. And the third being advancing recovery across purpose-focused settings. So that includes recovery-ready workplaces, higher ed, and high schools. And lastly, we do focus on advancing recovery evidence and research by collecting, analyzing, and promoting recovery research and evidence for all of our strategic focus areas and objectives. Thank you for being here today. And without further ado, I'd like to introduce you to Linda Gargan.
Linda, you're on mute.
On mute.
Well, of course I am. Okay, let's try again. I'm Linda Gargan. I'm the Executive Director for the National Federation of Families. And those of you who know us know that our world is all about supporting families and family peers. And we support families who are supporting their children who are experiencing substance use and or mental health challenges. So you're in the right place. It's like when you get on the plane and they say this flight's going to Los Angeles. If that's not where you're going, get off now. So we are here to talk about some advocacy things, some running peer organizations things. We've got some fabulous, fabulous people here with us today. You see the pictures of these 3 beautiful women. Anita, Shauna, and Carla are going to just blow you away with some of their information. This is going to be a discussion, and you're part of it. But before we do that, I need to know how you're doing. So go down to your reactions. Let me know what kind of a day you're having. Are you having hearts, thumbs up, thumbs down? How's your day? How's your day going? This is how we get to know one another. Look at the hearts. Wow. We are having some good days. This is awesome. And isn't it great to see all that? Isn't it wonderful to see that people are doing well? We're not getting much, that looks like people need some peer support right this minute. So this is great. Thank you so very, very much. And if we could take the slide down and let's get our speakers up on the um, uh, screen, that would be fabulous. And we will get started. Um, and I don't know how to put the speakers up on the screen, Gail, so help me out here. But I can be talking to people. Sherry, it's good to see you. I mean, Lauren, did you say you're from West Virginia? Who
Linda,
said they
everyone is spotlighted now for you.
Someone said they were from West Virginia. I was wondering where you're from. Okay, so ladies, what kind of day are we having? Are we doing well? Yeah, my speakers are doing well. My speakers are on mute, and you're going to have to come off mute if we're going to talk. That's sort of part of the plan here.
This day started off a good day already for me, and this is just another good element of the day. This is always a good crowd to be around. It's good energy, it's uplifting, and I'm excited to be able to share information with this group and have dialogue, and potentially even bring back something that I will learn from all of you as well. So I'm excited and definitely feeling good.
Absolutely. Well, let's start out by letting people know who you are. Anita, I'm going to start with you. Introduce yourself. Tell them anything you want them to know, even if it's something that you don't want everybody in the world to know. That's okay.
Hi, everyone. I'm Anita Bradley. I'm with the Northern Ohio Recovery Association. I founded the organization in December. It'll be 22 years. We were the first peer-driven organization in the state of Ohio. I'm a person in long-term recovery. I'm actually on vacation having a wonderful time, but I'm excited also to be here with you.
Now, where are you vacationing, Anita?
I'm in Puerto Rico.
Doggone. No wonder she's having a good day, right?
Yeah.
Okay, Shauna, how about you introduce yourself and just tell people anything you think they should know?
Sure. I'm Shauna Kasuba. I'm the Education Outreach Coordinator with ACMH, the Association for Children's Mental Health. I may also come to this role with the experience of a peer as a parent support partner here in Michigan for 5 years. I'm also the mother of a beautiful blended family of 8 children. It can get complicated at times, but it's definitely magical at times. I'm also passionate about dance education. I'm also the founder of a nonprofit organization for taking dance into shut-in areas of our community, just to build some resilience and bring a moment of joy when possible. So,
Okay, and I've got to say this. If there is anybody on here who would have guessed Shauna has 8 kids, speak up now. I mean, look
well,
at
biologically, I have 5.
You just look so together and so calm every time I see you. We'll have to do a webinar on Shauna's parenting tips later.
It's been a journey.
Okay, Carla, introduce yourself.
Thank you. And yes, a webinar just based on Shauna would definitely be well worth it. She's amazing. I'm Carla Preto. I'm the executive director at the Association for Children's Mental Health. I am the mother of 3 beautiful children, and I came to this work because I lost one of them to suicide in 2017. And I really had no idea around all of the advocacy that happens around peer support. But I knew in my heart that there were things that were in our experiences that maybe could have been done differently or better. And I felt like I wanted to use those experiences to like, to not have those missteps for other people. And it led me to this work where people were already doing these amazing things already. And it just flowed right in. And I'm just in awe of everything that I hear people doing all the time. I'm so genuinely appreciative. And I hope that I'll be able to offer some of the things that were challenging for me getting started in this work so that it can help some of you. I saw in the chat that we have people from all different levels and experiences. So I hope that we can help offer some things for everybody today from what I saw. So I'm excited. Yeah.
Wonderful, wonderful. We're going to have a good time and we're going to learn some things here today. So guys, let me try to set the table a little bit about what we want to talk about, because as those of you who know the Federation, you know that our major platform this year is keeping people in their communities. We're concerned, and I'm sure many of you are, we're concerned that we are seeing a move towards reinstitutionalization. We're seeing trends, we're seeing executive orders, we're seeing DOJ opinions. So we're nervous. And we know that a major component of keeping people in their communities is those of you who are on this call today. But we also know that sometimes being an advocacy organization or being an advocate and being funded by state or local or federal dollars, those two things can create tension sometimes. You see things that you want to change, and yet you know that your funding source will not be so happy if that's the direction you go in. So we're going to talk about, some real life situations. These people who are with us today can talk about some real life situations where they have seen this become an issue. And we're going to talk about, what do you do when you get in that sort of tension? How do you navigate that? How do you move forward and continue a positive relationship with your funder and yet advocate for the services and supports or simply policy changes that you know are in the best interest of the families you're serving? Does that sound good to everybody? Is that what you came for? All right, so let's get started. So each of you, I'm going to ask you some questions, and I'm going to ask you to help our audience understand. All three of you, and I know Shauna and Carla are in the same organization, but you are all working in situations where you receive some sort of state or local or federal funding. Is that correct?
Yes.
And I'm sure none of you have ever been asked by those funders to do something that didn't quite align with your values. It's okay to say it here. This is a safe space. Because what I can tell you, as these guys are saying, how are we going to answer this question? What I can tell you that in myself, because when I was not in this work, I worked as a provider of intensive in-home family therapy services. And then I moved to this work in the nonprofit world. And there have been multiple times when I have seen policies come out or laws being passed that were not in the best interest of families. Can you guys talk about some times when you've seen something like that happen in your situations? And whoever wants to go first, you go first.
I'll jump out here. I think we see that all the time. Like different laws are being passed that we may not be in agreement in. Recently in Ohio, there was a situation where a gentleman that was, I think he had been in like a mental institution and was out, wasn't supposed to carry firearms, and he did, and he ended up killing a police officer. As a result of that, there's a law that just passed where they've changed the time frame for people to be ruled competent or versus not competent. And so just looking at those in terms of like the concern is like, how do you put a timeline on something like that? And so, as a result of this one person doing what he did and not, um, promoting or endorsing it in any way, but it's going to impact so many other families. And so just like trying to stay on top of information like that and communicating with our government officials and lawmaking bodies and knowing who believes what policy, getting to know them, letting them know what your opinion is, and doing the homework before we speak to them, I think is a great way to advocate. And also just knowing what role we're in. I'm the executive director. Sure, I get money for funding to provide services, but I'm also a resident in the area. I'm a mother and a wife and all those other things. So just knowing what hat that I'm wearing is important.
Anita, that is such a great starting point for us because you have several different hats that you're wearing. And sometimes you're speaking as a family member, but sometimes you are speaking as the executive director of a large organization. How do you wrestle with that? How do you make space for both of those?
You want me to continue?
Sure.
Sure. Again, I just know what hat I'm wearing. I've done it for so long. I've been in recovery for over 35 years, and so again, I'm a person in recovery. The program taught anonymity. But I'm also a person that's able to vote. I'm also, so what is my intention? Is what's important. What am I intending to do? And that dictates what role that I wear. And then I just have to do my homework and prepare. Learning what the policies are, learning who I'm talking to.
Yes.
How do I go in and talk to a legislator? Like, what do I need to know about that person? I need to know what they believe before I even go in and talk to them, and just prepare. And always, just really being honest. What's worked for me is being honest, but speaking from my heart, and not necessarily always. I'm not saying data is not important, but not always like really giving like all the background, but something short and sweet, because people's time is limited and their attention span is sometimes short. So we need to go in, say what we want to say, and sit back and breathe and see what they have to say, and just be prepared.
Great points. And I think the way you do that with your legislators, I can tell you from my experience, if I'm going in to speak with a legislator, eh, whatever level, state, fed, whatever, I research their family
Yes.
because I want to know what we have in common.
Mm-hmm.
Have we lived in the same places? How many kids do you have? Has your family experienced, if you can find that information, any sort of mental health or substance use challenge? Because it gives you a starting point, a commonality. I think that's great.
Mm-hmm.
Carla, Shauna, what do you think?
Yeah, I agree with everything that you said, Anita. And I think knowing your intention going in is really important. Are you going in representing your organization? In that sense, you're representing more than just your own personal agenda, right? You are representing your whole community. In our instance, we're a statewide organization, so we're representing an entire state of individuals.
Right.
And so it can't be my own personal agenda. I have to be representative of the greater good of everyone, right? And so that's important going in. We recently have had some intent to restructure how our mental health, our public mental health system is structured within our state. And there was a request for proposals for our prepaid inpatient health plans. And I had to understand who were the players involved. So there was leadership within our community mental health system who were targeting legislators. And it is important to know who your allies are, but it's also important to know where are you going to have the most impact and who are the players? Is it at a policy level? We have a mental health code that is going to govern some things, but where is also the beginning of this proposal coming from? In our instance, it was through our DHHS. And so where is that leadership determining this proposal from? What is the basis of why they are proposing this in a way that everyone else seems to be in opposition to it? There has to be some basis for that. And for me, I needed to understand that. So for me, my approach was meetings between our community mental health association leadership. We had the CEOs of CMHs. They brought in legislators sometimes. We had advocacy org leadership that was there. And the discussion was a lot of people coming to the table already with their plan of how it should be. And it was, again, to me, even though everyone is coming wanting something better, it was the same problem as the state was coming with. I have this answer. Here is what I'm going to push on you. And so I had to come in and tell everyone, I don't agree with any of you. What we need to do is have everyone in the room together, to have dialogue, to understand where everyone's coming from. To me, it sounds like everyone has their reasons behind why they are coming with these choices, but nobody's listening to each other to understand, like, where are the weaknesses in what you're proposing? Where are the strengths in what I'm proposing? And if we can do that, if we can come together and have dialogue, we can make a more robust plan considering all of these perspectives, right? And so I think it's important to understand who those key players are, because you had a lot of entities who were trying to mobilize around the major player, who was the state, the department, and really they needed to be in the conversation too. It needs to be a together conversation. And so I think building those relationships to be able to bring everyone to the table, that's also a key component, is not just on the legislators and knowing where to advocate, but it's knowing everybody who needs to be part of the conversation and being able to bring them into the same room.
Definitely. I think we all agree collaboration is so important. Now, Shauna, you bring a different perspective to this. And I want you to help us understand from your role, if, let's say, your state of Michigan, um, creates a policy that you know is going to it's going to contradict what your peers are trying to do in your work. How can you address that?
Is a great question, Linda. Thankfully, I'm not trying to skirt around your question. I'm leading up to it, but thankfully, I've been seeing an encouraging shift. And like you said, I do have a different lens just in my role as an education outreach coordinator versus an executive director. And I'm personally seeing some encouraging shifts where, leaders are moving from asking, can you share your story, to asking, can you help us build a better design? How can we design this better? And we've had partners being open to hearing, like, how do we bring family voice into leadership? So with that said, I'm trying to imagine if that looked different, But I would say, one of my top priorities and goals is to bring family voice as high up into a system as possible. I feel like we're having success with that. So again, that's not really answering your question, but that's where I'm sitting right now.
Yeah, no, that's absolutely what I wanted you to bring. I'm going to share a very specific situation where I, as a provider and as an advocate, had to go up against the system. So, as I mentioned earlier, I used to be the director of a huge intensive in-home family therapy program. And as we were getting started and we were selecting staff to come to work with us, and we had our clinicians, we knew who we were going to be having there, but now we're trying to get our peers, and that's so important. And one of the things that I knew was that we were going to be working with a lot of families who were in one way or the other involved in the legal system. And they were going to need help navigating those systems, or their children had gotten involved in the justice system. Well, in the state where I lived, people who had been convicted of crimes could not be in these jobs. And I knew we could not provide effective support to these families. It was not going to be true peer support if we could not bring in peers with like experience. So I spent quite a bit of time with our state HHS, our Medicaid system, really helping them to understand the importance of me being able to hire nonviolent people who had justice involvement. It took a while, and it took me being able to gently move in that discussion. It was not a discussion where I could go in as the angry advocate, because I could get my money pulled, and it wouldn't have been helpful. Eventually, we did come to an agreement, and we were the first provider in the state allowed to hire individuals who had criminal involvement. These things don't happen quickly, though, do they? They don't happen overnight. If you get in a situation where, and Anita, because we talked the other day, you shared a situation that I know was very personal for you, but if you were willing to share it, I think it would be wonderful for our audience. If you get in a situation where you're going to have to really take a stand, what's the best approach? And Anita, if it's okay, I'm going to ask you if you would mind sharing that situation.
Oh boy, it really just depends on the situation, like you said. So the situation you're referring to is that so I'm in the Cleveland area and I work in Cuyahoga County, which is I think the second or third largest county in the state. And my brother went to treatment in 2023. They did the intake and everything and sent him over to detox and said that his bed would be ready in I think 3 to 5 days. And he called the center for about 8 days and they stopped taking his calls. And then long story short, I have a really good relationship with like all of the providers, the county, and just like everybody, not everybody, but in the community. But anyway, long story short, it became personal, and someone said on the Zoom meeting that they weren't going to accept him back to the center after they had said that they would. They ended up trying to refer him somewhere else. And on that Friday, he left the detox instead of going to where his things were and said he was going to go to treatment on Monday. He ended up overdosing. And so the dilemma for me was that I felt that they were negligent and that there was some discriminatory parts to the case. And a part of me was grieving, and I didn't really know how to handle it. I knew if I had like contacted the media and really made us think about it, that wasn't going to help me mentally, you know what I mean, and socially. And then I just really didn't want to be a part of anything just public like that at the time because I was grieving. So I spoke to the board and told them how I felt, and I contacted an attorney, and I handled the situation privately, and it worked out as best it could. It never would bring my brother back, but the center acknowledged their mistakes. I was able to speak to them. I was able to get some, closure for his children. They weren't children like 19, 21, that kind of thing. But it was the best that I could do. And at the same time, I could see the policy change because there was a rule where now they have to answer calls within 24 hours. And, just things like that, what we should be doing anyway. And then the person who was on screen saying what they said had to do some training, and then I challenged their credentials. But I learned something in the process while I was looking at credentials and looking at what they did. I really, what I didn't do was contact the state licensure, but it still worked out, and I was content with the results because what I really wanted was to ensure that that didn't happen to anyone else's loved one.
So, Anita, I mean, that story is, first of all, it's just heartbreaking that that happened. But I am thinking about in your position as the executive director of a large organization that receives funding from the state. Did you feel threatened at all? Did anything about that situation make you feel that your funding could be threatened?
Yes, more so at the local level, because if I challenge them too aggressively, I think even though I have a really good relationship with them, yes, in the back of my mind, there was the thought of, Anita, you could jeopardize your funding, and that's why I didn't go to the media. I went to an attorney, and I asked the company, the other organization, to sit down with me. And I think that was the better approach. Like sometimes, like I said when we were meeting last week, sometimes you need to be an agitator, and I have done that as well for different policies that was coming along like years ago. I would get to the recovery community because where we live, we have one of the largest recovery communities in the country because, Alcoholics Anonymous started in Akron, and that's in my back door. But anyway, I have had hundreds and hundreds of people to call different places depending upon what the situation was. But at those times, that was needed. In this case, again, because of the grief, because of the relationship, I just felt like it was better to handle it privately. I was at some point offended because I really did try to reach out to them before going to an attorney, and they did not respond. So that forced me to contact, an attorney, to force them to sit down to listen and hear what I had to say. And not so much of what I had to say, but what needed to change in the system so that someone else's child or brother or wife or husband doesn't go to a center thinking that their bed is going to be available, and only to find out that they're going to be disappointed because their call is not being answered. And I had proof of these things. And so, again, everything is all about approach. It's all about being strategic. It's all about your intent, your heart, and what it is you're trying to accomplish. But also, I believe in being, persistent. If you really believe in something, sometimes you have to be persistent, and change doesn't always happen overnight. I've seen some things. I started working in peer recovery in 2004. It took 2018 for the state of Ohio to allow recovery services to be reimbursed. So though, it's a lot, it takes time, it's a lot of education. And again, sometimes if there's someone who's in opposition with what we think, we have to remember that two things can exist in the same space, and you both can have parts of what you're saying that is correct. But how do you come to some consensus? How do you normalize what you're trying to do, but also validate what they're thinking?
That's somewhat like what Carla was talking about with bringing people together. Now, I want to do a chat moment here. Those of you who are a part of our call, who are part of our audience today, let's go to the chat for a minute. Have you been in situations where you have needed to advocate for something, even knowing it could be a threat to your funding? Who do we have that has had this kind of experience? Sherry Lyons says yes. Yes, we've got a couple of people who've had this experience. All right, so let's learn a little bit about this. Look at this. Look at this. Wow. Okay, so Sherry, tell us just a little bit, just a thumbnail about your experience.
We have a current initiative in our state for big dollars to be used for young people that are falling through the crack of intensive services. And it's a House bill and it's got a number to it. So I'm going to keep that private. And there's a bunch of money. And when I say a bunch of money, those of you that are executive directors of nonprofits, you know that it's way more than what we get, right? A bunch of money to meet the needs of families. And the way that it was being distributed, and we had a family peer on their team. It was not true to how our philosophies are about sustainable needs being met. And so throwing money, big money at problems, leaving families where they cannot continue to pay their rent after the project moves on, and things like that. Setting people up for failure when they were already in a vulnerable spot. I went to the person who was my contract holder, which was with the governor office of our state, and told him that I did not want to do the contract anymore, but I wanted to bless the work in another family support organization. And he tried to convince me to hire back people I let go for ethical reasons. And it was very hard because one, I felt disrespected as a leader, an executive director. I wouldn't go to the governor and ask the governor to hire back people I let go. But this individual wanted me to do that. I did let go of that contract. It was fruitful money for our organization, but it didn't align with how we work with families and setting people up for success. And I did a lot of prayer about it and held strong. And yeah, that was really challenging for me. And there was, I'm sure, some rumors and scuttle stuff going around. But in the end, I think the respect of a common voice and how we partner with families and systems for the good of the people that we're supporting, I think that stayed true to our values and our principles in practice. And it was one of the most difficult things I had to do in my career.
That is like the ultimate when you have to say, I just can't take this money. And you're right, Sherry, there are times, and I applaud you for being able to do that. But that is truly the ultimate sacrifice as an executive director, and to say to your board, we just can't take this money. I actually made a decision like that very recently. And we were asked to partner on a grant, and the people who were asking us were fine people, but our missions did not align. And I respectfully declined to work with them. And thankfully, my board was very supportive. They're an amazing board, but sometimes you have to look at your values and make sure that you're consistent about that. So thank you for sharing that. Um, okay, Carla, tell me what has happened for you where your money's been threatened and you have stood up?
Well, first I want to say, Anita, you nailed it. That mission drift is like putting a name to it, right? I think you do have to really assess, is this aligned from an organization standpoint, or are we now not just are we aligning with what we believe in, but are we spreading ourselves too thin more than we can even manage, right? That's not good for any of the work that you do. And so it all becomes relevant in making those decisions. And I think that it's very admirable, Sherry, that you backed out even once you had accepted that funding. That's a really difficult position to be in and a difficult decision to make, to back out of having funding that you've already accepted. I think for us, I don't think that we've had a place where we have had to turn funding away that didn't align necessarily. I think we have a lot of conversation internally to review funding up front to say, is this something that aligns? Is this something that we would have capacity to do before we get to that point of accepting it? So fortunately, we haven't had that encounter. I think where we did have an experience that I think what one piece of information that maybe could be helpful for our audience to take away, there's never an answer that encompasses everything. There's not just one solution to everything, but one thing that I have found in my life that has been beneficial is, how do we reframe things? How do we reframe them to where it can be something that is a benefit to us rather than a barrier to us? When I think about that, when I stepped into this role as executive director, and there had been a lot of efforts around, DEI efforts internally within our organization. And I said internally, before anything happened on our federal landscape, I said, whoa, like, let's hold on, because for me, this is just baseline humanity. This is not an add-on. This is something of how we should just operate as human beings. And it's how we should just operate. And so we got rid of these add-on things, and we just built it into our processes of how do you act like a human being. And so when things changed federally, there were so many people who got very upset and disturbed by that change and removal of language. And my reframing of that was just, but we just do this. I don't care about the semantics, but the reframing is just sometimes as important. I'm going to do what I know is right to be a human being. And that's the part that sometimes carries us through. We have to pick our battles. Are we standing our ground to fight a fight over a word, or over how we enact what it is that we're doing, right? What we're doing is we're interacting. Yeah, we're doing the right thing. We're interacting with people the right way. We're, helping people the right way. We're treating people the right way. We're giving people the open-mindedness to interact with them without judging first, right? Those are the important things, not what you put on a piece of paper, what word you put there. And so I think that is applicable in more than just that setting. It is how you can help reframe things to not set you back, because so many things that we face as challenges are bigger challenges because of our mindset. It's a mental thing. we hold ourselves back when we find those to be our own barriers, and we can try to reframe them in a way that even if it's just within yourself, you're like, oh, this is a challenge. Okay, I'm going to take it on, right? And then you like can try to find your way around that. So I find that to be my approach that works for many things. Not everything, like I said, but for many things. Oh, you're muted still, Linda.
Sorry, guys, I've got dogs barking, so I'm trying to keep them down. I love the reframing notion. I think that's powerful. And I think we can probably, if we can reframe, we don't get caught up so much in just the semantics of policies. Now back to the chat for a minute. Gail, you didn't just say yes, you said big old yes about this problem. So tell us about your experience.
Oh,
Well,
well, as
it's similar to everybody else's experience. So we look like Carla did. The board, we was awarded a grant last year. It was a new venture to provide recovery support services to youth and young adults. And our niche is youth and young adult. Some other folks got some other uh, population ages, but ours was youth and young adults. So the challenge became, how do we have a conversation with the funder to let them know we we may have a different perspective on how youth are using substances in the community other than how they wrote the grant. It was the first time, it was the first impression. Nobody had done this grant before. So the funder had challenges too in understanding what is the rollout process, what is the target population, how do you identify the youth, and so on. So to make a long story short, it became very hard for us. We went 6 months with no funding coming from this grant talk, but this organization and the board was determined to stay in this because it was bigger than us. We saw the bigger benefit. We saw the need in the community, and we put on our advocate hats. We went to city council. We advocated at civil council. We testified at city council the benefit this community can have if we find out what is a more accurate number of youth using drugs, not just the marijuana, but really how can you determine what is, first of all, what is true marijuana and what is laced marijuana? Why are we underreporting the overdoses? So we testified, we went to roundtable discussions at the city council office. We proposed, we advocated and stood our position. So now we are getting fun. It was tough, but I was determined not to give up because I feel if I give up on trying to figure out how to help these families, and especially when across the country, the youth are getting a lot of focus on these meetups, and it's resulting in children going into systems. I was determined we're going to figure out how to back these out. So we've been very successful in going into criminal court and getting some of these cases put into mental health diversion court, and they've been dismissed. So, that's our stubbornness, that's our focus. And sometimes you have to roll with the hot sauce, as they say. When you're in a political town, you have to be political.
Yes, Gal, I have testified before your city council before. And some days that's lovely, and some days, holy moly.
I know.
I know that was a battle.
So
And
we
you
doing
are
the work now. We are doing the work, and we happy.
And for those of you who don't know, Gail is actually right here in Washington, D.C., and there's not a more political place in the country. So if you ever need tips on gentle advocacy, she'd probably be the person to get in touch with.
They all know me.
Okay, so we are not getting many questions in the chat, which I'm not happy. So let's get some questions, guys. What kind of questions do you have for this group? Because I've got more questions that I'm going to be asking them, but I want to make sure you get your questions answered. So please put your questions in the chat or your comments, just your comments. What's happening? What are your life experiences trying to balance the provider side and the advocacy side? Let me go back over here for a minute. Okay, so Carla has told Gail that she's emphasizing some of what she mentioned, making sure you get facts involved. Yes, yes, yes. You got to have your facts. Passion is not enough, that's for sure. And an emotional dialogue needs to be balanced with facts. Yes, I can remember a time where we just told people all they needed to do was tell their story. And your story is hugely important. But if you don't have some facts to back some of that up, then you lose people. So that is very critical, particularly if you have money involved and you want to keep your money, but be able to provide the supports that you believe are best. Um, wow, Denise, I mean, this is a question. Holy. Okay. So, guys, let's look at this. If you were starting from scratch today, how would you balance advocacy, public education, and peer support? That is a whopper of a question. What do you guys think? Who wants to go first?
I'll jump out there. Let me look at something again. So it's interesting because like some funders in the applications, if you ever sign off on contracts, they tell you that you can't lobby, you can't advocate. So a nice way of framing information when you pass on information is education. So you can educate people, legislators, school systems, members of the public. You can always provide education. And sometimes I think those words could be used interchangeably. So, if you can't lobby, if you're not allowed to advocate, you can educate, even if it means like a public official, right? So, but I also know that like some organizations hire like lobbyists and people to advocate for them. That's very, very different than what I think some of what I'm hoping what we're thinking of. And so just really knowing the rules, and if you have questions, perhaps speaking with an attorney who has expertise in this particular area so that you're not putting your funding in jeopardy. So there's a way, and we are all allowed to educate and inform people. And I want to say this again, data is important when it's used in the right way, but sometimes people aren't just looking for data. It just depends. Some people are looking for the story. Some people are looking for the data. Some people are only moved by data. So those are the people that you give data to. But people who are moved by emotion, if you do your homework, you'll know a little bit more about how to approach them. Makes sense, I hope.
No, I think you're right. And it is knowing your audience. That's huge. Shauna or Carla, what's your response to this question?
I don't mind speaking up for Carla on this. If you probably have something to add to this, but as I was listening to this, Anita, you'd mentioned the word, I don't think you used the word interconnected, but close to it. And I was sitting thinking, and I was feeling like at ACMH, it feels very interconnected for us. I feel like this, the peers that, we come alongside help us understand, what our families are experiencing today, what they're going through, what the barriers are. And then with that public education piece, I feel like, we're taking that knowledge and it's helping us with our messaging across, our communities and organizations and the different trainings and webinars that we're doing. And then the advocacy piece, I feel like we're taking, how we take what we're learning and we take that towards lasting change. So for me, I feel like it's very layered within ACMH. Each one informs the other, if that makes sense.
Yeah, I agree. It is very interconnected. And without knowing a little more about where exactly the question is coming from, if you were just getting started, I would say even coming into this work into an organization that had over 30 years of having been started, we're still growing under my leadership. We're still growing under our current communities, under the current climate. And that has taken us just really being intentional piece by piece. And so what we have seen is we have our peer professionals that are growing in the state. And as those have grown, we've seen that we have a need to educate the turnover in providers, the turnover in case managers, the turnover in people who would be referring for peers to better understand what are these services, what makes a good referral. So we need that education piece, right? So there's that niche. And then we've understood, you know what, we talk a lot about family-driven, youth-guided, but you know what, as a family member, myself, before coming to this work, we say that a lot in the work we do, but I never heard that before at all before I came to this world. Maybe we need to start educating our families and our youth about what this even means, right? So there was that piece of it. And then we have all of these child and adolescent health centers within our schools in Michigan, and Shauna has made connections with them. And like, how do we build up the education and that piece of things, right? They have a really strong network. So it's been like these little bits of pieces where when you, even if you're not just starting out, like you grow, you find where there's this opening where you can spread to, and then you move into that space and you will find that you start making connections with new people that have other connections, and you just start building off of that. And when you do that, those three things become very interconnected. Like Shauna said, you have peer work that inevitably is tied to education needs, that is inevitably going to need some advocating around the needs of families that come out of that. So it's all very interconnected.
Great question. Good conversation. Gail Cormier, I see you've got your hand raised. You're on mute.
Linda must run in our organization. I have two different questions. One that I have my hand raised on, but one in the chat. And I'll do the hand raised one first, if you allow me to do both questions. I feel, Carla, and just help me with this. I feel that developing relationships, even before you have to actually challenge anything, is probably the most critical piece. For instance, I know that a lot of us get state and federal funding, and I know we're supposed to diversify and get everything, but let's be real, a lot of it comes from the state or from even insurance agencies that we support. So making those critical relationships prior to having to challenge them are important. And I know from my way of working it, I would be invited to all these meetings because I didn't have to challenge them at that moment. But when a challenge came up, I would raise my hand and smile just shyly and go, you know what I'm going to say here? And I wouldn't be blaming. I would be kind and supportive and say, hey, this is my role and I'm going to put my other hat on right now. We can't do that. Is that how you work, Carla? Or what do you think about relationships?
I think relationship building is everything. And I think being true to yourself and how you show up is everything. So you don't shock people when you do state how you need to operate in those spaces. It's very clear when I come in to talk with other leadership, and they are building lobbying messages, and I come in and say, you know what, I'm really supportive of what your message is, but I can't sign our organization on because we don't have funding that lobbies. I am putting us at risk, and I just can't do that. If you could reframe it in this way, I could sign us on, but I can't as it stands. And when I've said that, there's been like 5 other organizations that have been like, I'm so glad you spoke up. We're actually in that same situation. Thank you so much, right? And nobody is shocked. Nobody thinks that I'm being disrespectful. Everybody's like, oh, yeah, thank you so much. Okay, can we change? What if we change the message like this? Would it be okay? We really want you involved. We can change to do this way because we want all of this to be supported by all of you. So it changes the direction of everyone. And then honestly, it changes the direction in a more powerful way, in my opinion, because it's less directive and more informative of this is actually the needs that exist. And it's almost a more powerful message, at least in the instances that I've seen it shift from that very directive to a more advocacy lens. But in other settings, building those relationships has been everything. And I'm very, I think it is something that is probably a strength of mine to manage difficult conversations. I don't take anything personally. I don't get personally threatened by anything. And so if we're having differing opinions, that's okay. We can have dialogue around that. I don't need you to align with everything that I say, but I need for all of us to be respectful and hear out why you feel this way. And I will always come into a conversation. If I feel strongly about something, it's because I have reason to feel strongly. But if you convince me with your facts that I should feel differently, I will always be open to changing, right? And that's what needs to happen in dialogue. So I expect that of everyone involved. And so this has allowed us to come into a space with all of our CEOs from all of our CMHs. We were invited into this space, and we had a really good roundtable discussion with other advocacy EDs. And it went so well that everybody would like to continue meeting quarterly. And they asked for me to co-facilitate those meetings, again, like with the CMH leadership. And I think that that's going to be very productive because there's a lot of things that the advocacy orgs feel very strongly about wanting the CMH system to know about. But it needs to be dialogue. It doesn't need to be fighting. I don't think in that venue that's the thing to happen, but that occurs when there's relationship building, right? And trust. That's it. Like the trust comes when you build the relationships, and that's how we affect change, right? We are all human beings within our systems that make our systems. So it takes all of us. We're not actually fighting something abstract. We're fighting ourselves. So we have to like have that awareness that it takes all of us to start changing our mindsets.
Yeah, thank you, Carla. And I just wanted, my other part of the question is for the other workforce population we talk about, and that's family peers. And I've often, when I ran my org, I had family peers and I had contracts from either the state or from a managed care organization that actually paid for me to pay for family peers. And then my family peers are supporting these families that are using their services. And then, of course, they're sitting around the table identifying, a high fidelity wraparound team. And they're saying, well, this is what the family can have. We're not giving them anything else, not being person centered. And the family peer says, well, this is what the family has identified. So a family peer is actually coming against the same folks that are going to be paying their contract for that person's salary. What do you tell your staff? And Anita, this is for you and Carla. And Shauna, what do you tell your staff? How do you balance that?
I had it typed in the chat and I didn't send it, but I was just thinking as you all were speaking just about like compromise, and making sure you understand, what's important. I'm not saying to dishonor your value system, because anytime I've had to do that, it was usually like I'm thinking job related when I first entered the profession. If I didn't have the same values or if I believed strongly in my own value, then I needed to walk away. And those were the times usually when I did move on to another job. But I think, to be honest, what I love about what I do and being able to be the CEO is that I get to identify some of the challenges in the community, the fragments in the system, and the inconsistencies, and I can work to make those better for others. And that's really what's been keeping me occupied over the last years and fulfilled in the work that I do is addressing the different inconsistencies in the systems and things that I think keep loved ones and family members from receiving the services that they need or becoming as healthy as they can be.
That was such a good response. Carla or Shauna?
I would love to hear, Shauna, your thoughts from your perspective, especially from your peer work.
I have like 7 thoughts going. So Linda, can we go back to where this started for just a moment? Or was it Gail?
So Gail's question was, how do you work with your peers, and I mean the peer support specialists who work with you, if they hit a situation where what I guess the funder, for lack of a better word, is saying they'll do for a family when that peer support specialist is hearing the family say they want something very different. What kind of guidance do you give them?
Well, I'm going to speak from a peer's perspective on this one. And I feel like we bring that into ACMH as well. So as a peer, if there was a mix matched desire coming from the team versus the family, I would always advocate, come alongside the family to find their voice and also be bringing that. And I don't know if I'm going off the rails here, but also do my best to bring that into the space of the treatment team. I'd always advocate for a seat at the table in those scenarios. Thankfully, I had a really great supervisor at CMH I was at that did give us a space in that. And I think that we bring that to ACMH. We're like, we want our peers like to find your space at that table at your CMH. Get on that treatment team. Ask to be part of the meetings. Ask to be part of any staff case management type meeting they're having, and bring it. I just feel like I was constantly buffering this bridge, right? Like this bridge piece, this relationship piece. Like build a relationship with the family, build a relationship with the treatment team, and help bridge that. But I'm hearing it's interesting. I was hearing a common theme throughout hearing Anita talk and hearing some of our participants talk. But this loops me back to, I call myself the no roadblock mom. That's, how I've advocated for my children, especially one with a intellectual disability. That's been my biggest challenge. And so I feel like I bring that mindset into my work as a peer and at ACMH. And so no roadblock mom doesn't mean that there's not any barriers, they don't exist, but it's the moving from the why can't this happen to what relationship do we need to build and who else do we need to bring into this conversation to access exactly what is needed, what the family needs, what I need. So that's how I would approach that.
I love your description of a mismatch of ideas.
That was my nice version.
I'm going to have to remember that. So when I'm setting a table and someone has very divergent opinions, I can say, I believe we might have a mismatch of ideas.
Yeah.
Shauna, something you said made me think about the importance within how things are structured within our state, that I think the concept could be elevated in other areas, even if your state's not set up the way ours is. Our agency doesn't employ our peers. Our peers are all employed through our community mental health agencies or their contract agencies, but we do all the training of them. And in our training, we also train the supervisors, and we train the peers that they're the professional too, and they can state, their roles within the treatment team as well. They don't speak on behalf of the families, but as peers, sometimes they are conveying what they see, or sometimes the family will need for them to help as well communicate a message or whatever. But we make it really the standard that the peers are their own entity. They're not there to go along with what the provider said. They're there to be able to help the family or the youth to say what it is that they need, period. They're not there to make their own decisions of what should happen. They're not there to push the agenda of the team. They're just there to help the family and the youth find their voice to say what they need. And so that's the distinction there, right? And that agency is paying their salary. So they're going to have to keep paying them, even if they disagree there. Right? So that might happen very frequently, but we set the standard that is the role for these peer professionals. And here is how we help those peers to have difficult conversations when these arise. Here is how we help in our technical assistance for supervisors to supervise consistently for the peers, to have those conversations in technical assistance with us if they need support with having those conversations. But we set the standard for what that looks like throughout our state. And I think that that's something that could be done for the profession everywhere.
I like that. Now, Parrish, you've got my attention. I don't know what fan training is. Can you unmute yourself and explain that to me?
Facilitating attuned interactions. It's from the Erickson Institution. Sorry, I'm in the car. But when she said mismatch, that's exactly what I was thinking of, was my fan training. And it's something that we discussed to, try to align the conversation. And oftentimes as a fan trained facilitator, the idea is that, obviously we reach a goal, but recognize that people start at different positions, on this particular model. But it's very interesting. And, it helps professionally and personally. So, yeah, from the Erickson Institute.
Can you put the name of that in the chat so people will have that?
Absolutely.
Because
Sure.
That's one I've never heard of. Let's learn something here, guys. This is exciting. All right, guys. So, question.
If I may, I just wanted to add to it what FANS stand for, which is a family assessment of strengths and needs. And it's primarily made it varies by state, but for instance, in New Jersey, Lions define it for 17 domains. And its primary is an organic conversation between the family support partner and the family, where the family identify the specific needs that they would like them to work with together and make an action plan with the support of the family partner. But the primary is the family who core herself and identify which may be that they would like to
That is very interesting. Something I
Yeah, and that
definitely
may
want
be a little different, but I'm putting mine in the chat. That's a little different than what I was speaking about, but I'm putting mine in the chat now.
Thank you. Thank you.
Of course.
All right, a question, guys. I know you guys do such an amazing job, but if you're anything like me, there has been a point at some time when you've had a colossal failure in trying to balance your advocacy and your funding. Um, would you be willing to share something like that? I learned so much from my failures. Um, have you ever had a situation where it just did not go the way you wanted it to? And how did you work that out?
Yes. We were part of the cohort that we applied for the statewide family network funding that was the NOFO that came out from SAMHSA last year. And then that NOFO did not get funded for any of us. And so that was a substantial part of our organization's funding. So I was panicking just a little bit. And what I had to do was go to the state and ask them if we could amend our contracts so that we could, whatever was funded off of what would have been funded off of the SFN grant, if we could rearrange within our grants to keep everyone funded so I didn't lose any staff. And they agreed to do that. But that's because, again, of the relationships that we built. They trust in the work that we do. They trust in us. And they wanted to be able to support us in every way that they could. And so they have supported through our state grants. And hopefully now we'll be able to go after the SFN NOFO that is out currently. But it's been tight for several months now without having that. And it was a bit of a scare. And I think as an executive director, all the things that happen on our landscape and within our communities, the funding piece is the thing that like I lose sleep over at night, right? Because that's what keeps us afloat doing the work. That's what pays all of our staff. That's their livelihood. So that's the part that I lose sleep over. So it's tough.
Absolutely. I think everyone on this call can agree with that. Anita, have you ever had a time that your balancing just didn't work out the way you wanted it to?
Which time?
You sound like me.
I'm thinking, let me think about that. I mean, there's been so many times, it's like what Carla's saying, that different funding sources come out. I'm thinking one in particular, this CCBHC, Community Behavioral Health Clinics. They were funding organizations to become more comprehensive, really. And so the first round, when they had like the opiate dollars out there, I just felt like they was throwing all this money out, what for that and those settlements. And so you had all these organizations open up, and then there was one RFP where you could get $1 million for 4 years, but the one that I ended up getting was 2 million for 2 years. And so it was like, imagine trying to do twice the work in a shorter period of time, and then other people, have longer. So it's almost like better to me to have more time to really plan and do things right as opposed to try to rush and, it not going well. I've always said I like the long-term funding better than short-term because it allows you to really assess the community and make the changes that's that's needed to make, instead of just really, like utilizing dollars just to be utilizing them. It's like we're trying to make impact, we're trying to make change, we're trying to support people, we're trying to train peers, license peers, mobilize peers. And so we want to do it right. And we don't just want to do it because the money's there. We want to do it right, and we want to do it with integrity, and we want the outcomes to be good, and we want people to get better. And so that's one of the times that, for me, if I had to make a change, I'd do it a little different.
Yeah, that's a big one. All right, we are running out of time, guys. So I've got one last question. I'm going to ask you just for a quick response. It's a question you could spend hours answering, I'm sure, but let's have a quick response for those folks who are on the call today. The question is, if you were going to give advice about how to balance funding and being a provider, what's the one thing you would tell the folks who are on this call today? What's the one piece of advice that you would give them?
Build relationships everywhere. It doesn't cost anything, right? It doesn't cost your
True.
funding. You all can do it at every single level. Every one of you. Just build those relationships.
I do like that.
Mm-hmm.
Anita, Shauna, one piece of advice that you could give folks?
Yeah, I would say make sure that you execute what you say you're going to do.
Oh, yeah.
And I would have to say relationship building and execution and with intention, aligned with your mission. And
I do like that answer. I think, and I mean, executing is huge. Doing what you say you're going to do is so huge. All right. Well, guys, I want to just thank you for being with us today. Those of you who have participated, thank you. Thank you. Those of you who have been a part of this presentation, you've done a fabulous job. Thank you so much for that. As you can see some information about what the Federation does and where our advocacy work is this year. Please feel free to join us. We have a conference coming up in October. Would love, love, love to have all of you in lovely Disney. So please feel free to be with us. We will have another webinar coming up in August. So please watch your information and join us if you possibly can. Thank you, Carla, Shauna, Anita. This was lovely. I do appreciate you helping us today. Folks, that we have a survey you're going to be directed to, and when you finish that, you'll get a certificate of attendance. So please do that. Thank you so much.